الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Pasturella species by Professor Mahmoud Hani Sulaiman. Definition: frequently pasturella infection is a cause of skin and soft tissue infections after an animal bite or scratch. Pasturella infection often is part of mixed bacterial infections. Complications include septic arthritis, osteomyelitis. Less frequently, pasturella infection causes pneumonia in patients with underlying lung disease. Other deep-seated complications are uncommon but carry high morbidity and mortality. Epidemiology distribution is worldwide. The principal reservoir is animals. Infection most often occurs after bites or scratches from dogs and especially cats. Again, dogs and cats are harmful animals. Infections reported after bites or scratches from a large number of other animals. Infections also occur in individuals with animal exposure without bites or scratches. So it is occupational among those working with animals. Microbiology: non-motile facultative anaerobic gram-negative coccobacilli grows best on sheep blood and chocolate agar. Can be difficult to isolate many species. See the table. Several other related species of genus Pasturella cause human disease. These are the Pasturella species. Pasturella species and Pasturella related species. Clinical picture: progressive skin and soft tissue inflammation after an animal bite injury, especially after puncture wounds. Isolation of organism from wound or tissue culture, often as part of a mixed bacterial infection. Sputum or pleural fluid isolates from patients with underlying lung conditions presenting with lower respiratory tract infections. This is a photo for a boy, Pasturella maltosida cellulitis, secondary to multiple cat bites. Again, it is the responsibility of cat owner or dog owner to prevent this from happening. And again, do not leave cats or dogs with little boys or girls. Multiple cat bites of face of a 1-year-old boy. Right forearm of a 1-year-old boy bitten by a stray cat. The child developed fever, redness, and swelling 10 hours after bite. He was taking amoxicillin for otitis media at time of the bite. The child responded to treatment with IV cefuroxime, although fever persisted for 36 hours. Pasturella maltosida cultured from purulent material obtained from wound the day after admission. The most common manifestation is cellulitis at site of a bite or scratch of a cat or dog. Again, cat or dog are harmful animals, or other domestic or wild animals. Cellulitis typically develops in 24 hours. Cellulitis of injury and includes swelling, erythema, tenderness, serosanguinous to purulent drainage at wound site. Regional lymphadenopathy, chills, and fever can occur. The most frequent local complications are abscesses and tenosynovitis, but septic arthritis and osteomyelitis also report. Other less common manifestations of infection include septicemia, CNS infection as meningitis, brain abscess, subdural empyema, ocular infections as conjunctivitis, corneal ulcer, endophthalmitis, endocarditis, respiratory tract infections, even pneumonia, pulmonary abscess, pleural empyema, epiglottitis, appendicitis, hepatic abscess, peritonitis, and urinary tract infection. People with liver disease, solid organ transplant, or underlying host defense abnormalities are predisposed to bacteremia with pasturella multocida. Therapy, management of bite wounds. First, management of bite wounds. Pasturella multocida is susceptible to most penicillin, second and third generation cephalosporins, tetracycline, fluoroquinolones, trimethoprim, sulfamethoxazole. Susceptibility is less variable with macrolides and other antibiotics. Aggressive surgical debridement of soft tissue infection is important. Aggressive surgical debridement of soft tissue infections is important. Penetrating bite wounds over hands lead to tenosynovitis and are a surgical emergency. Surgical emergency requiring incision and drainage. Prevention antimicrobial prophylaxis for selected bite wounds, done usually with amoxicillin clavulanic acid 875 mg orally twice daily for 5 days. And at last, I say Alhamdulillah Rabbil Alameen wa thank you for your good listening.